The Move, Look, and Listen podcast with Dr. Doug Stephey is brought to you by Audible. Get a free audiobook download by visiting audibletrial.com/inbound. We'll have a link in the episode notes for your convenience. Many of the books mentioned here in the podcast are available in Audible. Sign up for a free 30-day membership trial, and you can download any book you like. Support the Move, Look, and Listen podcast with Dr. Doug Stephey by visiting audibletrial.com/inbound.
If our two eyes are not working together well as a fast, synchronized team, our internal MapQuest continues to be off. It's consistently inconsistent with our ability to judge time and space. Those that don't feel well grounded, those that have some measure of anxiety, oftentimes it starts in the visual system. If you can't move, look, and listen in a fast, accurate, effortless, sustainable, age-appropriate, meaningful way, you're in a world of hurt. There's a whole world in vision and how it affects brain function that no one's ever shared with you. 2020 is perceived as the holy grail of going to the eye doctor. Well, I'm here to change that paradigm. Hello, welcome to the Move, Look, and Listen podcast. We have a new episode today. We're talking about psychoeducational testing. What is it? Who needs it? What does it mean? How do you get it done? And what do the results tell us? And our guest today is Tania Whiteleather. She is a special education attorney that I've known for a couple of years now. She is wonderful at the job she does in helping the kids that have these needs. And with her advocacy support and the clinical support that I provide and other providers like myself, I think this is a critical episode to get to know this information. So Tania, welcome, number one. And would you tell us a little bit about yourself? Because I learned recently that you, in another lifetime, were a classroom teacher.
Oh, yes. Good morning. Yeah, I started out, that was my first love. And I taught a middle school, a little crazy. I was a general education teacher and ended up the last 5 years of my career in LA Unified, where I worked in Southgate and was the department head and loved it, but I had trouble with administration who didn't want to supply books on time and didn't seem as interested in the students as I was. I left, I went to law school, and I've now been practicing for about 30 years. Sounds really old. And discovered special education a few years into my practice and have not looked back.
Yeah, it's a powerful modality, and clearly there's a monstrous need for what you do.
That's true.
In a perfect world, you would have to find another part of law to practice because there wouldn't be a need for attorneys such as yourself, but that is not the reality.
A few years ago, I actually spoke to a psychoeducational evaluator, an independent, and said, look, pretty soon my job will go away because all these school districts are going to learn. And in fact, it's just gotten worse.
Yeah, that's true. So let's start off maybe briefly. Will you review perhaps what child fine regulations are, and then we'll begin to transition right into the topic of the day, and we'll just get right to it.
Okay. Several decades ago, it became clear that children were being excluded from school because they had a disability. I swear I'm going to do a montage of film, because if you all think of Forrest Gump, the young man who was excluded because he was not considered bright enough to go to school, you have an idea of what our schools used to be like mid-century. Students who had Down syndrome, students who had other issues were routinely kept out of the school and not educated. Congress got together and first had the Education of the Handicapped Act, which said, no, you have to locate children. You have to do child find, it's called. And identify their needs that would impede an education, and then address those needs so that they can access education the way that non-handicapped, non-disabled students do. The terminology changed. It's now called the Individuals with Disabilities Education Act. We call it IDEA for short. And child find is the law of the land. Child find means that students whose education is impeded by a disability must be assessed, identified, and provided with the services they need to allow them to access. That's been clarified recently in a couple of wonderful Supreme Court decisions. Despite what's going on in our world, things are moving forward a little bit, and we now have a clearer picture. We have to make access to a child appropriate to the student's level of skills. So if you have a child who's severely brain injured and is learning how to walk and hold a cup, obviously you're not going to put that child in a physics class. You're going to be doing something that's more basic. But if you have a child who can't read, who happens to be very bright, and that is not uncommon, then you must provide the services to allow that child to access the same type of education the non-disabled peers do. Child find is wonderful. It means the states, which get money from the federal government under IDEA, must literally beat the bushes, even find the homeless, to identify their needs if they have a suspected area of disability.
And then just to clarify the point, I'm going to make a run at this, and it's almost verbatim from what I can recall, but it goes something like this. Child find regulations stipulates that districts will have written policies and procedures to seek out and find the kids with these needs, and that they will be comprehensively assessed by qualified personnel in all areas of suspected disability, including vision, auditory, cognition, speech, language, motor, and audiology.
Absolutely.
And what I find so intriguing about that is I'm not convinced that districts, by and large, have any written policies and procedures about how to identify who's at risk, what's our referral protocol to a child who has a vision-related learning disability. And I suspect that they don't have written policies and procedures, for example, on who might have a central auditory processing disorder. And I'm curious, Tania, from your 30 years experience in this area, have you ever seen a district's written policy on vision therapy or a central auditory processing disorder?
I have not, but it's not my practice to look at them, but I have done something that may shed some light. In hearings, a number of times where we had a child find issue, a student who was failing, who couldn't read, and nobody had referred the child for educational assessment. I would ask each and every teacher, do you understand child find? Seek Out and Serve is the California version of child find. And each teacher would say, no, what is that? Well, do you refer a child for assessment? And they would say, oh, no, that's not my job. So there may be a policy in school districts, but teachers do not know anything about it.
I'm stunned. As the first line of defense, as the professional who interacts with students in a learning environment every single day, 10 months out of the year, 5 days a week, that is astonishing to me. But that's the reality of what we deal with on a daily basis. And that leads me into one of the topics I wanted to briefly discuss, because I've got a number of them to pepper you with today. And that is, who can make a referral for psychoeducational testing? And just for the listening audience, to clarify, would you maybe give a succinct definition of what psychoeducational testing is?
Oh, succinct? Okay, I will try. Psychoeducational is done by an assessment that is fairly broad, but often includes touches on areas such as vision, auditory, speech language that are not truly the purview of a psychologist, but gives sort of a generic look at that to determine whether additional assessment may be warranted in an area. For psychoeducational assessments, those are conducted typically by a school psychologist who is not really a licensed clinical psychologist, but has some training and holds a license through the state as a school psychologist and acts under the umbrella of somebody in the district who actually has a clinical psychology license. So they may or may not have much training at all.
And generally, the psychoeducational testing is a measurement of IQ versus measurements of academic achievement. Yes?
No, not quite. We have had, for years, we used what's called the discrepancy model. And you would, in assessing a student to determine eligibility for special education, one of the big areas is called specific learning disability. And we would use what is called the discrepancy model. Is their IQ discrepant or 22 points away from reading, writing, math, or anything subpart of those academic areas? That has been done away with. In 2005, Congress reauthorized IDEA and said you don't have to use discrepancy model. You may. And some school districts still do. We have a little hiccup here in California because California, of all the states, has said that you cannot conduct IQ assessments for students who are African American. Now, this was some years ago. Called Larry P. was the case because the group of plaintiffs that went to the district court alleged that IQ tests were culturally biased and specifically identified 3 tests. The end result was an agreement, not a court order or after a trial, but an agreement between the parties and a court order based on that agreement. And ever since, the California Department of Education and a number of districts refused to conduct IQ testing or anything like it on minorities. Now, there are a number of cases that came after, such as Crawford v. Honig, that say, no, that's perfectly acceptable. Parents just need to ask. But the psychoed should look at something like ability. It should look at academics. It should look at all those areas that you mentioned, Doug, the vision therapy, needs in occupational therapy, speech and language, all of those related areas, and give an idea of class needs.
One of the things that has always bothered me about that IQ achievement discrepancy model, and again, for clarification, if your child's IQ measures at a certain level, and yet their measures of achievement, reading, writing, and math, is significantly below that level of measured IQ, that's where this discrepancy model would come from. And then collectively, it seems like districts would say, well, because of this discrepancy, we may diagnose you then with a specific learning disability, which in my estimation means you're clearly struggling with the academics of reading, writing, and math, or some variation of thereof, and we can't explain why. So we're going to give you this specific learning disability diagnosis. But what really bothered me is when your IQ doesn't measure as high, so there's not as much of a discrepancy, and now you're told as a parent that, well, you know what, your kid doesn't qualify for extra help, so we're not going to give them that label, and that they're really doing as good as they can. And this is harsh, but it's the coding of the language behind that comment when you don't have this IQ achievement discrepancy that, in my estimation, and again, it's harsh, is when you're told that there's not that discrepancy, what the district is really telling the family is, you know what, your kid's too stupid to help, and we're not going to spend resources and time to try to do so. And that's just wrong.
Sadly, many of the school psychologists, we have manuals, the publisher's manuals for how a test is to be administered, how you score it, and how you interpret it. For things such as the Woodcock-Johnson, which is an IQ test, there are subtests, and they each evaluate a certain area of cognitive. And understanding this is really complicated. I don't understand it all, but trying to summarize for all of us. The IQ is measured by all sorts of things. I have a neighbor who's next door who doesn't read, but he's a framer. He's brilliant that way.
Yep.
Because what he sees, his visual, okay, but I can't do what he does. He can't do what I do.
Yep.
So IQ tests measure different types of intelligence. And some parts of the Woodcock-Johnson, it's a largely language laden, full of language test. And students, children, people who have a problem with language, they may be very, very smart. But if they have difficulties with language, they cannot take the Woodcock-Johnson assessment and perform well. So what you're measuring, if you give that type of assessment to an individual with a speech-language disability, you're measuring their disability and coming out with a low number. You can't really say what their true ability is. With a speech and language issue, you need to do a nonverbal IQ and say, look, this person has problems with the language, but if you take out language, they're very bright. Now we look at math, reading, writing, and see if there's that discrepancy, or we see if they need help to just do what their grade level is.
That's true. And on a similar note, and it's something that you kind of alluded to, if you're a visual spatial learner, you tend to think in pictures, not in words. And so you're not going to do well on a measurement that is primarily measuring sequential processing if, in fact, you're a spatial learner. And that's a huge problem for these kids. One of the other things that I've learned over the years is that, from the best of my recollection, about 30 to 40% of a measurement of IQ on the WISC, the Wechsler Intelligence Scales for Children, that roughly 30 to 40% of that outcome is really a measurement of what you have already learned. And that is very different from an assessment such as the cognitive assessment system that is looking at a theory of intelligence known as PASS, P-A-S-S, planning, attention, simultaneous, and successive processing. So my point being is that if 30 to 40% of a standard IQ test is really just a measurement of what you have learned, but you don't have the abilities, okay, now ready for this, wait for it. If you don't have the abilities to move, look, and listen, you can't learn as much. And if you avoid measuring that kid's IQ until third or fourth grade, the reality is you've probably dumbed down that kid's IQ in that window of time because they've struggled so much with their abilities to move, look, and listen. And if we would assess these kids either pre-K or kindergarten or first grade and better understand their abilities to move, look, and listen, and treat those disabilities so that they're more age appropriate, we can identify these kids earlier and close that gap and not snuff out their desire to learn. Let's go back to who can ask for psychoeducational testing. Certainly the teachers could and should. Is it your impression that they're encouraged to make those referrals to the school psychologist?
Do you hear me laughing? My sister's a teacher in a local school district, and she has been told, do not refer students. We could not handle. She's in an inner city school where many of her high school students can't read, and she's been told don't refer them.
A teacher should be the front line and should make those referrals, but they're they're told not to. Then it seems to fall to the parents to ask for testing.
Yes, parents are a good source. Obviously, I think that pediatricians often look at a child and say, oh, well, they'll get onto this. No, they're not speaking right now. They'll speak in another year. Oh, they're not doing something that is typical for this age. Let's give them a little more time. Trying not to alarm the parents, and there are kids who are just slower. Pediatricians can be a helpful source. Parents, especially if they have older children, start comparing, which is what we do, and figure it out. Parents are a good source for referrals. And if a parent says, I want, by the way, it always should be in writing. I tell my folks never, ever do a referral or request orally. Put it in writing, email, walk in with a piece of paper, get them to stamp it. Parents are an excellent referral source. And the law under IDEA says a district must assess in all areas of suspected disability. So what is suspected? Suspected is the parent saying, he doesn't seem to hear well. Or I say things and he doesn't respond. Or my daughter can't get the words out when I ask a question to properly respond to my question. All of those, without being specific, identify potential hearing issues, speech and language issues, which the school district should then assess in because they have now become suspected areas of disability. But sometimes that often doesn't happen.
What's interesting to me about that comment is the examples that you just gave are related to speech and language or listening. And nowhere in there does vision factor into that. And so one of my contentions is that phrase in child find in areas of suspected disability. And it seems like it leaves potentially a little wiggle room for a district to say, oh, well, we didn't suspect a problem in vision. And that goes back, for me, it goes back to written policies and procedures. And an example would be, well, show me a copy of the behavioral rating surveys that you have given to the parent to determine that there was not a suspected vision disability. You can't simply say, well, we did a vision screening, the kids can see 20/20, so everything's fine about vision, right?
Correct.
No, there's nothing further from the truth of that. So that problem with areas of suspected disability really has to get hammered home. And I think it goes back to the written policies and procedures that by and large districts don't have, because there's no parent I have ever seen in my 30 years of practice that has come in with some sort of a vision survey that they were given by their district that indicated that there was a risk of a vision-related learning problem. So on a related note, so let's say that the parent has written a letter, hand-carried it into the district office, got a time and date stamped about when it got turned in, and they've requested psychoeducational testing. Now, I guess what I'm asking next is it legal for a district to refuse to do that testing? And on a related note, is it legal for a district not to answer that parent in terms of yes or no, we're going to do the testing, but instead, is it legal for a district to reroute the parent and say, oh, well, we need to convene a child study team and talk about this?
Okay. First of all, while it's not absolute in the law that a district must assess, I cannot ever say I've seen a situation where a parent has made a request for assessment that the district had any valid excuse for assessing. I guess if they came up with something that said, this child is doing perfectly and has all A's and has no problems, they might argue their way out of it in a hearing. But generally, if a parent makes a request for an assessment, that starts the whole process, and a district must respond within 15 days. The district is supposed to provide the parent with an assessment plan. It is not an appropriate response for a district to say, oh, we're going to refer this to some other group, or we need you to go to your doctor and get an assessment, even if it's a medical issue. And this is a very interesting area. I have a student with about 16 experts up in Northern California. She's medically a mess, misses 40% of the school year. There's no way the district has the experts to assess her. So we have agreed to allow the experts' assessments and assessment reports to be part of her IEP. But the district has to review those. The district, if it believes or has any reason to suspect there's a disability must conduct or obtain assessments in those areas of suspected disability. And I started to say a minute ago, you hit the nail on the head. When the districts do a psychoed, their vision is really what's called a screening. It's not a full assessment. They have the child look at the letters on the wall and go, look, I can see those letters. And they say, fine, there's no problem. And school psychologists are not trained to go beyond that. So as far as delaying, the district reasonably must give an assessment plan, must conduct the assessments, but must look at all areas of suspected disability, and then has to go beyond that with certain other steps.
So it's not really appropriate to not answer that parent's question and say, oh, well, we need to convene a student study team or a child study team, which I've seen happen way too often. And then the parent doesn't know better. So they go to the child study team, and somehow the outcome of that is that their request for formal psychoeducational testing actually never gets completed, and it gets withdrawn off the table. And maybe 6 months, 9 months, a year or longer goes by, and as oftentimes is the case, they might find me from the podcast or a word of mouth, or found me online in some other forum. And then when I talk to them, I'm like, well, you need to go back and re-ask for the psych ed testing, and do not take no for an answer. Because we got to get to the bottom of, why is your kid not benefiting from the instruction that they are otherwise receiving at school in a way that their peers are benefiting from? And then, of course, that starts a whole new round of, let's go get the testing done. And then let's find out if you're comprehensively assessed in all areas. And if not, well, then we're going to ask for independent educational evaluations, which is the topic of the next episode. So you're going to want to come back and listen to that episode about what happens when your child does get tested, but not comprehensively assessed in all areas, like Child Find says that they should be. On a related note, let's say you get the psych ed testing done. And what I find really interesting recently is, so look, I have an opportunity to read through a lot of these reports, and frequently we'll get to pretty much the last page, the last couple of paragraphs, which is your child eligible for an individual education plan, hence IEP, or a 504 plan, which is a slightly different discussion, but basically and ultimately, the conclusion is that either we did find your child qualifies for a diagnosis of a specific learning disability, and we will offer them some sort of help or accommodations or modifications to the curriculum, or they did not find to be qualified for a diagnosis of specific learning disability. And I have found myself recently in reading reports in that manner and looking at them in a whole new light. And the conversation I've had with a number of parents is, well, that's great. I mean, I'm glad that your child doesn't have a specific learning disability, but it doesn't mean that they don't have a disability in auditory or motor or vision. And they may have a qualifying diagnosis to get an IEP or a 504 plan and get other help. They just don't qualify for the specific learning disability diagnosis. And of course, that's never conveyed in the kind of psych ed summary that we're talking about, because it seems to be singularly funneled down to, does your child have a specific learning disability or don't they?
I think you've hit the nail on the head. Again, when you deal with school districts and you're dealing with school psychologists, they don't have the training or depth of training that clinical psychologists do, or people in related fields such as vision therapy, auditory processing. And districts are often focused on a specific learning disability. They don't look at other areas, which are clearly outlined not only in IDEA, but in California law, the states identify them, but they're not exhaustive. We had a decision from the Ninth Circuit a few years ago that said central auditory processing disorder in and of itself can qualify a child, make him eligible for special education. The litmus test, is whether or not the disability impedes education. If it impedes a child's ability to read and comprehend material, then that would be a disability impeding, and they should be made eligible. And I don't think the Ninth Circuit would turn that away. However, we have hearing officers that are so focused on this is what's in the code, they miss the other things, as do school districts.
And on a similar note, the Office of Special Education Programs, going back at least, I think, 5 years now, wrote a policy about convergence insufficiency and other visual diagnoses that interfere with the child's ability to access the curriculum. And as such, that is considered a visual impairment, differently than the more classic definition of visual impairment, which is a reduction in best corrected visual acuity. So if your kid's like 2200 or worse because they have some sort of eye disease or eye injury that's reduced their visual acuity, or they have a reduction in their peripheral vision, that's the more classic definition of visual impairment. But the OSEP policies that came out 5 or so years ago really has turned that on its ear. And it's really my impression that districts don't know those policies that come out of Washington, D.C. very well at all. But perhaps we'll talk more about that in and of itself in the next week's episode when Tania comes back to talk about independent educational evaluations. And so as we wrap up today, hopefully the takeaway messages, the action plans, if you will, know about child fine regulations and that your kids are entitled to be comprehensively assessed in all areas of suspected disability by qualified personnel, and that includes vision. You can ask for psychoeducational testing and you'll get a written assessment plan back from your district within 15 days of your submission of your request. That if you're being rerouted to a child study team, that is not okay. And the IQ achievement discrepancy criteria really kind of was officially tossed a number of years ago, yet there are still districts that cling to that and still use that criteria. And we have workarounds to all of those things. Tania, I just want to thank you again for sharing your expertise with the group today, and I look forward to talking to you again in the next episode. Oh, and then one final thing. Tania, how could our audience get in touch with you for more information and more resources?
Well, I am in Lakewood, California, and unfortunately, the districts locally are keeping me as busy as all heck. I belong to CAPCA, which is a resource group. I belong to COPA, C-O-P-A-A, Council of Parent Advocates and Attorneys, which is nationwide. And that is a group that can provide you with all sorts of good info. I would encourage parents to also go to their local CACs for each district. Some of them are heavy-handedly run by the district. Others are more independent, but you can get information with those sources.
Tania, thank you once again for sharing your expertise with the audience today. And I look forward to the next episode when we talk about independent educational evaluations.
I've enjoyed it, and it's a pleasure to be here with you, and I do look forward to next time. Thank you.
Thank you for listening to the Move, Look, and Listen podcast with Dr. Doug Stephey. All of the resources mentioned in this podcast and links to learn more about our guest can be found in the episode notes from whichever podcast app you might be listening with. You'll also find a link to Dr. Stephey's website, which is stepheyoptometry.com. That's STEPHEY optometry.com. You can also call the office at 626-332-4510. We'd like to take a quick moment to thank our sponsor, Audible. If you love podcasts, you'll love listening to audiobooks with Audible. Many of the books mentioned here in the podcast can also be found at Audible. Dr. Stephey has a free audiobook waiting for you as a gift just for listening to the Move, Look, and Listen podcast. Simply click the link in the show notes to audibletrial.com/inbound. Sign up for a free 30-day membership trial, and you can download any audiobook you like. And if for any reason and at any time you choose to cancel your membership, you get to keep all of your audiobook downloads. It's risk-free and for free for 30 days. Support the Move, Look, and Listen podcast by visiting audibletrial.com/inbound. We really do appreciate you listening. And until next time, for Dr. Stephey of the Move, Look, and Listen podcast, I'm Tim Edwards with the Inbound Podcasting Network.